First of all, I'll give you the global situation. As of this morning, there were 1.5 million cases. We crossed the 1.5 million threshold as of 9 a.m. East African time, with over 80,000 deaths globally. In Africa, we now know that there are over 11,400. That is about 11,400 cases have been reported in 52 countries. And of these individuals, unfortunately, 572 have died. But the good news is that 1,313 people have recovered from the infection. That is very, very encouraging. Now, I'd like to put these numbers in context. When last week we briefed with you all, our numbers were still around 7,000. So between last week and now, we have increased by almost 4,500 cases or infected individuals. That is a rapid increase in our numbers, and we continue to be very concerned with the direction and trajectory that this virus is heading in Africa. There are about 5 countries that are heading the chart now in Africa. South Africa with 1,800 cases, Algeria with about 1,500 cases, Egypt follows with similarly with 1,500 cases, Morocco 1,200 cases, and Cameroon or 650 cases there. So those are the top countries that we are observing and tracking there. Africa CDC continues to work with the African Union Commission to support member states in as much as possible to respond to this pandemic on the continent. As you are all probably aware, the Bureau of the Head of States have established the the African COVID-19 Response Fund, and as we speak, currently there is already a pledge of about $12.5 million into it. We count on you all to rally the support for this fund so that we can actually begin to use it to continue to support our member states. Second, the task force or the continental strategy that we established at the level of the Africa CDC and member states has now been fully endorsed by the Bureau of the Head of States as a mechanism to coordinate, cooperate, and collaborate and communicate across the continent. So that is very, very encouraging. We continue to take the advantage of modern technology to train countries online and provide them with the appropriate platforms using different media trainings there. As you are all aware, we had a very massive effort with to support the efforts and leadership of the Jack Ma Foundation and the Prime Minister of Ethiopia to distribute several items across the continent 2 weeks ago. And we are expecting another shipment that is arriving or probably has arrived already, and we will continue to work with them to provide that support. We, as you know, we are in the response mode. We have Africa CDC staff posted in Cameroon, Nigeria, Sudan, Zambia, and of course Ethiopia, and all supporting the government, the country's effort in that exercise. And lastly, and very importantly, is that we have a network of clinicians, about 300 clinicians that we are supporting and training regularly, just preparing them for case management. It's a question of time before our number of deaths will increase, and it's a question of time before we need that very technical, specialized support to care for the patients that will be in need of that special service. Lastly is the technical trial and research component of our strategy has now been reinforced. We now have a technical working group that will oversee all research and clinical trials that are conducted on the continent. We continue to rely on you to advise the population on to take preventive and hygienic measures, including appropriate hand washing. Appropriate hand washing is different from just washing your hands, which means you spend at least 20 seconds washing your hands with soap, and wash them well, both inside and outside of your palms. We want you to continue to work with us to encourage people who feel sick and have symptoms of flu to stay home or consult. We want to continue to work with you such that social distancing is maintained. I know we have challenges that we have large families and communities we live with. Again, this is a wicked enemy that we have to take seriously and respect that enemy, that which is this virus, and do everything we can in our capacity to stop the enemy, deny it the opportunity to spread.